Time and again, I have seen how the discovery of a brain and spine tumor has caused anxiety and even turmoil to a patient and his or her family. There is always a frantic search for information, expertise, and guidance to understand the disease, its implications, and the best way to treat it. Having a brain or spine tumor at the most unexpected time can really be terrifying and most definitely life-changing. Here at Cardinal Santos, we have multidisciplinary care focused on effectively managing these diseases. For any given case, our doctors collaborate and work together day in and day out to come up with the best possible treatment options to save a life and to make a difference. In an effort to raise awareness about the importance of gathering medical experts with different specializations in treating brain and spine tumors, Cardinal Santos Medical Center is holding a webicon entitled "It Takes a Village to Save a Life," a webicon on the multidisciplinary approach to brain and spine tumor management. Part of our advocacy is to make quality and innovative healthcare accessible to everyone. Hence, an initial primary goal is to educate you about these diseases and the life-saving services that are available at your disposal. At this point, let me make a short segue on how Cardinal Santos Medical Center has become a cornerstone and a center of excellence in the management of neurosurgical diseases in the country. The CSMC Brain and Spine Institute was the very first institute established in Cardinal Santos. 2 decades into its inception, it has made Cardinal Santos a center for advancements and innovations in the field of neurosurgery in the country. The vision started with this man, the late Dr. Eduardo Reyes Mercado, a pillar in Philippine neurosurgery, a past medical director, and my neurosurgical partner for 13 years. One by one, he worked to bring in state-of-the-art treatment options for varying neurosurgical diseases. It started with the Philippine Gamma Knife Center, the recognized gold standard in stereotactic radiosurgery worldwide. It allowed a less invasive treatment option for brain tumors and other brain pathologies. This will be elaborated on by one of our esteemed speakers later on. This was followed by another breakthrough center in 2005, the Philippine Movement Disorder Surgery Center, or PhilMove. The following year, my colleagues, Dr. Jet Aguilar and Dr. Ted Besagas, with their formidable team, performed the very first deep brain stimulation for Parkinson's disease in the country. To date, Cardinal Santos remains to be the authority in the surgical management of movement disorders in the Philippines. Fast forward to 2008, again, under the brilliant visionary guidance of Dr. Mercado, the Multidisciplinary Brain and Spine Tumor Center was established. Amongst its goals, to form a team of experts of varying subspecialties geared towards the ideal management of brain and spine tumors. The process we had to go through, as well as our regular activities, will be elaborated as well by our next speaker. To date, we have 8 centers under the Brain and Spine Institute, making it a bastion of care for various neurosurgical and neurological diseases. By late next year, we are eyeing the establishment of a world-class epilepsy surgery center. At this point, I will now give you a short talk on the signs and symptoms of brain and spine tumors. So what is a brain tumor? It is defined as the growth of abnormal cells in the brain and can develop in any area of the brain. Curiously, there are over 120 types depending on their origin and behavior. And like any other tumor, it can be benign or malignant. Now, this artwork shown here was done by an artist named Sean Thornton. He's based in Philadelphia, and he believed that his artwork alluded to the presence of a cancerous brain tumor. He was correct. Doctors eventually found a mass in his pineal gland. He had treatment and is presently doing well. This slide will show you the common signs and symptoms of a brain tumor. I will be touching on these individually and in the process elucidate facts from fiction. Headaches would be the most commonly associated symptom to brain tumors. Headaches by itself is rarely caused by a brain tumor. The chance that your headache is a sign of a brain tumor is very remote. However, it may be the presenting symptom in 25% of brain tumors, and is usually a manifestation of increased pressure from tumor growth and swelling. This is a representative MRI showing a large frontal lobe tumor surrounded by perilesional edema, which of course obviously exerts significant mass effect on the brain parenchyma. Now, what would characterize headaches that would require immediate medical care? Progressive headaches, particularly those associated with a decrease in the frequency and intensity of the attacks, is a red flag. Headaches associated with severe nausea and vomiting, headaches associated with neurological symptoms such as a hemiparesis or weakness of one side of the body, or visual changes are likewise red flags. Headaches that worsen with exertion or physical activity such as sneezing and coughing should also be considered highly suspicious. Nausea and vomiting is a usual sign of increased intracranial pressure from an enlarging tumor or a tumor involving structures near the vomiting center, which is called their area prostrema, and it is located in the hindbrain or the back part of the brain. Brain tumor symptoms can present as vision problems, such as blurred or double vision, abnormal eye movements, and restricted field of view. They are typically progressive and occur at a fairly accelerated rate compared to your typical degenerative conditions. It may arise from two causes: from increased pressure in the brain, causing swelling of the optic discs, or from compression of specific brain structures subserving visual function. Now, these are key structures in different areas of the brain that may cause varying degrees of visual loss. As you can see, it is not limited to the eye or the optic nerves, but can also involve the temporal, parietal, and the occipital lobes where you have your primary visual cortex. So any tumor in those areas can cause visual problems. One of the more common locations for brain tumors would be the pituitary area here, which can cause the typical peripheral loss of vision. This is because of compression of the structure called the optic chiasm, which is where your optic nerves meet. And typically, they would cause loss of peripheral vision, as seen in this perimetric study, wherein you have loss of vision on the periphery of your right eye as well as the left eye. Used interchangeably with convulsions and epilepsy, a seizure is defined as the physical changes in behavior that occur after an abnormal electrical activity in the brain. Convulsions, on the other hand, refer to the uncontrollable shaking that is rapid or rhythmic with the muscles contracting and relaxing repeatedly, while an epilepsy is a term used once a patient has repetitive episodes of seizures, hence the term epileptics for those who have recurrent seizures. Just some trivia. It is a little-known fact that while Saint Valentine is widely associated with love and Heart's Day, he is also actually the patron saint of people with epilepsy. Seizures present in several ways. The more typical ones would be uncontrolled jerking movements of the extremities, which may be associated with loss of consciousness. It may likewise present as blank stares, accompanied by episodes of temporary confusion, and other less common manifestations, such as cognitive, emotional, or even sensory symptoms, like having an abnormal swell, etc. Some important facts about seizures. Again, most seizures are not caused by brain tumors. Seizures from brain tumors are usually focal in character, meaning only one side of the body is usually affected initially, but it can be generalized to involve both sides of the body. What is considered a red flag is what we call late onset seizures or epilepsy, which would be defined as seizures in adults for the very first time. This should now raise the suspicion for a possible anatomic cause, such as a stroke or a tumor, which would eventually lead to an imaging study. Balance problems are secondary to impingement of brain structures that control coordination. Because of the typical tumor location, it may also be accompanied by dizziness and cranial nerve dysfunction. What are cranial nerve dysfunctions? It may be numbness of the face, weakness of the face, hearing loss, and swallowing and speech problems. Involvement of the cerebellum, which is an important structure for balance and coordination, is a common cause of balance problems. In this example, you have a tumor in the cerebellopontine angle. This is the cerebellum, this is the pons, it is at that angle. So by affecting the cerebellum, it will cause balance problems, but it will also cause cranial nerve problems because of the involvement of the hearing nerve. So you will have visual loss and even facial numbness, and a late sign would be facial weakness. Drowsiness or coma is usually from progressive increase in intracranial pressure or from development of hydrocephalus, which, as you know, is excess water in the brain caused by blockage of flow, and one of them would be a tumor. It is usually a late sign and is a slow process compared to the drowsiness or the coma that you would expect with other diseases in the brain, such as a stroke. Another symptom that is infrequently caused by brain tumors but should not be overlooked would be personality or behavioral changes. This would occur from tumors arising in the frontal lobes, particularly if both frontal lobes are involved. Let us now go to spine tumors. As a background, the most common tumors would involve the bony structures, and these are called extradural tumors, and they would involve bone. Quite commonly, you would also see intradural, extramedullary tumors. They are within the dura, the covering of the brain and the spinal cord, but outside of the substance of the spinal cord. The rarer tumors would be intramedullary, which would involve the parenchyma of the cord. In terms of the signs and symptoms, the most common would still be pain, which would usually be at the site of the tumor due to tumor growth. It can likewise present with radiating pain from the back to other parts of the body, like the arms or the legs. Back pain is typically worse at night. The symptoms may be associated with loss of sensation or muscle weakness, especially in the arms and the legs. There may be difficulty walking, and sometimes this may cause falls. Now, most back pain, again, is not caused by tumors. But because early diagnosis and treatment would be essential, you have to see your doctor if any of these would present or would characterize your pain. If it is persistent and progressive, it is mechanical in nature, meaning it is associated with movement, with ambulation. If it gets worse at night, and if you have a history of cancer and develop new back pain, because this may point to a metastatic lesion from your cancer that would commonly go to the bones, more commonly the spine. Paralysis. Compared to the brain, paralysis from cord lesions would usually involve both sides, both arms and both legs, although they are asymmetric, meaning one side would be worse than the other. And this is usually accompanied by numbness or sensory disturbances. And it may be accompanied by changes in bowel or bladder function. I think that's my last slide. So again, thank you very much.